Welcome to Tea Time with Dr. T. I'm Dr. Tammy Malloy, and today we are going to be discussing how trauma lives in the body. Before we start talking about that, I'd like to discuss what trauma is. And I'd like to say that trauma is a bit subjective, meaning that I could be with you in a car and we could be getting into a car accident, and how I've processed that trauma or seen that as traumatic is going to be different for me than it is for you. And you'll hear some people say big T's and little t's. So I could have a big T of a trauma, but to you, that would be maybe a small t. So I think it's important to say that when someone comes to me and says, I think I may have trauma, it's not up for me to tell them that what they've experienced is traumatic. Because there are some times when someone experiences something and I'm hearing about it and I'm right away thinking, oh my gosh, that must have been so traumatic for you. And really like, no, actually not really, but I experienced this and this was a huge trauma for me. So again, it's important to note that. So when somebody experiences a trauma, sometimes they're not exactly processing it in real time, meaning that when trauma happens, sometimes you go outside of yourself. And in other segments, I've talked about that. You dissociate from what's happening. And that's a mechanism that's usually we develop at a very young age because our mind and our brain cannot comprehend what is happening to us. So when I'm explaining this to a client, it's like you have different rooms in your brain. And some of those doors are open and some of them are closed. And when we experience in a trauma, it sometimes shifts into this different section on our brain and the door closes. And sometimes we act like we're fine right after. And some people will say that that's shock. That sometimes will wear off right away that day or the next day. And sometimes it doesn't. The person's going around functioning like nothing happened. And they don't see anybody for that. And they just push forward. They've got too much to do. It's fine. I'm going to stuff it down. Now, when that happens, that can manifest inside of our bodies. And I like to call that the trauma pocket. There's been different types of people like Brian L. Weiss, who wrote a book, Many Lives, Many Masters. Bessel, who wrote The Body Keeps the Score. There's a ton of different books that discusses this, that sometimes people will have a lot of ailments. Their back hurts. They get really bad headaches. Their neck hurts, autoimmune disease, different types of things, digestive issues. I could go on. And really, that may be manifested at the time that trauma occurred and grew and grew and grew from there. And I call it the trauma pockets. So if any of you have ever been with a therapist before that says, listen, I want you to close your eyes and I want you to tell me when you talk about this, where are you feeling that in your body? This is why. And a lot of times people feel it in their chest, or they feel it in their stomach, or people say, I carry my stress in my neck. I know I say that. And that's where we want to dig in. We want to dig into those trauma pockets to try to look in there to see what's going on there. A lot of times too, I'll associate that with a color. Close your eyes, let's dig in there. And I want to see what color does that look like to you. So it's kind of like bringing it out of how it got so deeply ingrained in you that it's impacting your body. And it's bringing that out so you can see it, so you can touch it, so you can understand it. And I've worked with a lot of clients, both in residential care and in outpatient, to where once we've worked and processed that trauma, however you're working on that, whether that's through psychotherapy, CBT, EMDR, that they don't have those pains anymore. And that's, of course, actually after you've ruled it out. If you got in a car accident, you really could have some major issues. So you want to make sure that you're seeing the right providers for that. But sometimes you've been to the doctor and you can't figure out the source of that discomfort and that pain. So when we talk about trauma living in the body, that's what we're talking about. And again, it can look like headaches. It can look like dizziness. It doesn't necessarily have to be any type of muscle pain or joint pain. But as you're working on your trauma, that's something that you should be aware of. We'll be talking about a lot more in the upcoming segments, but today we're going to leave it there. So whether you're having a cup of tea with me or you're having coffee, I just want you to know that you're not alone.